Thanks very much. This is Suzanne Feaster. I'm president and CEO of Vitalist Health Foundation. We're an Arizona-based foundation, public charity that works and aspires to build healthy communities around Arizona. And so one of the things our board of trustees asked a few months ago as we were preparing our budget was, can you get some feedback on how the American Rescue Plan Act money is going to be spent, and then also get some community input on where community leaders think it should be spent. And so that we turned to Arizona Town Hall to help partner with us to put on a series of virtual webinars. And this really goes hand in hand this upcoming year, this whole year, and even part of last year. Arizona Town Hall had the theme of creating vibrant communities. And I'll let either Pat or Tara talk about the upcoming conference, but that we still hope to have in person with maybe some hybrid options. But what we wanted to do is talk about today is really have some feedback from all of you about where some of this American Rescue Plan Act money should be going, so that we can help communicate that and facilitate the conversations with policymakers throughout the state. And I want to give a shout out to one of the key policymakers who's joining us, who is Tom Simplot, the new Arizona director of the Arizona Department of Housing. So thank you for joining us. So let me turn it over to Pat.
Well, thank you very much, Suzanne. Ladies and gentlemen, thanks so much for being here today. We really appreciate it. My name is Pat Norris. I am the past chair of Arizona Town Hall. So I'm really a has-been, but I'm being called back into service to help for today. With Suzanne's help and her colleagues' help, we have put together a program that will allow you to do almost all of the talking, and we will be listening intently to your ideas. We have prepared 2 questions for you to address today, and although I know all of you can read, I'm going to nevertheless read the question, because since we're in this remote virtual environment, I want to make sure we're all on the same question at the same time. So we'll probably discuss each question for about 20, maybe 25 minutes. And the key to this type of conversation is for everyone in the room to listen and then to participate. That is why, if you feel comfortable in doing so, I would encourage you to activate your video, because if, for example, Harvey makes a point that Terry, you agree with, you could just say thumbs up, and it could be your real thumb or it can be your virtual thumb. So if you feel comfortable, that would be fabulous to activate your video. We don't normally in town hall sessions, we work with getting people to reach a consensus if they can. And that would be helpful here, because that means it's a more powerful statement. But again, we're really here to listen to your ideas and your thoughts on where should we be spending as a state our American Rescue Plan monies that will come to Arizona. And these are billions of dollars. These are not insignificant sums. So again, we want you to participate. Now, let me explain how I'm going to handle the meeting. For those of you who I can see, if you would like to speak, just raise your hand, or depending on the equipment you have, if you go down to the bottom of your screen, you will see a little smiley face, and under the smiley face is the word reactions. If you click on that, you'll see a raise hand, both a hand, a little gold hand, and the raise hand. If you click on raise hand, your hand will go up, your virtual hand will go up, and I'll see it, and I'll call on you. And then I'll put your hand down. Not all of you may have that equipment that allows for that. And so, for example, for Sherry and Josh on the phone, if you would like to speak, if you can make a comment in the chat room, such as please call on me, or just go ahead and blurt something out, I'll make sure that we call on you, because we want you to participate as well. Then I will try and call on everyone in order of the hands I see. But If you've already had a chance to speak and someone has not yet had a chance to speak, I'm going to reserve the right to be arbitrary and capricious, and I will go out of order to call on the person who's not yet had a chance to speak. But I promise you, I'll come back to you so that you will be heard. With a group this size, I always encourage people to think about what I call the 60-second rule. It's really not a rule, it's an aspirational guideline. What I have found in dealing with groups like this, and I'm a lawyer by training, so this is especially true to lawyers. If we as lawyers have gone on for about 60 seconds, we probably have said everything we need to say, and now we're getting ready to repeat ourselves. So think about that, the 60-second rule for yourselves and your comments. So I will be calling on you by name, as I explained, and if you would like, if you have some ideas or comments on what we're going to discuss today, again, please feel free to put them in the chat room, because we will be looking at the chat room as well in the discussion, and I'll try and call your attention to comments in the chat room. Now, any questions about how we're going to actually do this today, about the process? Okay, I don't see any real hands. I don't see any virtual hands. So let's go ahead and begin. As I said, we have two questions. They will sound a little bit similar, but they're really, really quite different. If you had a chance to look at the fact sheet that Vitalis prepared about the American Rescue Plan funds, if you turn to the second page, you'll see that we have essentially 6 broad categories in which the monies can be have been allocated. One is direct COVID response, public health measures. Another would be health-related programs, direct business aid, human services, housing assistance, education program and services. So there's 6 broad categories. The first question asks you to talk about these very broad categories and to prioritize which category should the monies be spent first, which is the most important category. The second question will ask you to address the categories and then to say, okay, for example, in housing assistance as a broad category, I think the money should first be spent. The priority should be in transitional emergency housing for people who are immediately homeless because of the pandemic. So first question, broad categories. Second question is more breaking it down into the categories. So let me begin then with the very first question. And then one last point. We're talking about priorities. Let me remind you that when we say this is important and that's important and this is important and everything's a priority and everything needs to be done at once, then nothing is done at once because nothing is a priority. So I ask you to think about making hard choices as to how you prioritize. So I'm sorry, did anyone have a comment? Okay, let's go ahead and begin then with the first question. Arizona is in the process of receiving significant one-time, and it really is one-time federal funding, including from the American Rescue Plan Act and then of course the CARES Act. Where are the most important areas to invest these funds to address disparities in health and well-being? So again, priorities. Where are the most important areas our state should take these funds to address disparities in health and well-being? Now, I know several of you, and I know that you are not a shy crowd. So feel free, once you have your thoughts in mind, to speak up. Terry, I think I see you, but I can't hear you. I think you're muted.
That helps. Good afternoon. Just for clarity, you're talking about the funds coming from the American Rescue Act, not the CARES Act.
That's right. The CARES Act monies, I think, have for the most part already been spent or they have been allocated. So really, we're talking about the billions the state will receive. It's in the process of receiving from the American Rescue Plan Act.
Okay, thank you for the clarification.
Hey, Pat,
Yes, sir.
this is Joe Jarvis. I work now for the towns of Taylor and Snowflake.
Mhm.
And from our perspective, hi, Terry. Um, the towns feel like the best way to use these funds is for one-time expenditures that can advance individual projects. We think it would be unwise for us to spend money that would require reoccurring operational expenses because the local entity probably doesn't have the operational funds to continue the project. And the federal government, I don't think, is going to continue to pass stimulus packages at this size. So we think it's most beneficial to pay for one-time projects. In our perspective, advancing water and sewer infrastructure and broadband infrastructure makes the most sense because those can be impressive one-time expenditures, maybe once in a lifetime expenditures. I've hit my 60 seconds. Can I make one more comment?
You sure can.
Okay. In some ways, this reminds me of 2008 when the Obama administration pushed money out to the municipalities, and we were all scrambling. At that time, I was with Winslow to say, we don't have any shovel-ready projects. And now we got to scramble to figure out some shovel-ready projects so we don't miss the window. And so hopefully this will encourage municipalities and entities, nonprofit and government, other entities, to have some projects waiting in the wings, putting together your capital plans so that if project opportunities like this come in, you're ready to move. Okay, I'm done.
Joe, that's an excellent point. And indeed, in the broad category of the 4.8 billion for direct COVID responses and public health measures, the American Rescue Plan, the regulations, the Department of Treasury issued just, I think about 60 days ago, specifically calls out investing in water, sewer, and broadband infrastructure. And indeed, if the commitments are made on or before December 31, 2024, the monies can be expended through December 31, 2026, because we all know you don't build a sewer system in 6 months. It takes some time. And so the monies are available until 2026 for these significant infrastructure plans. Other comments, ladies and gentlemen? Yes, Tom, thank you.
Hi, thanks, Pat. I'm so sorry to jump in like this, but I have to actually jump off of this Zoom call to jump on another one. And I just wanted to invite everybody on this call today to join us for another conversation, and that is a virtual Zoom meeting for a homeless track that we have put together for the Arizona Housing Forum. And I am happy, Pat, to send the registration information to you or to Suzanne, but there is no charge. And it is virtual live. And so people can participate in real time, just like we're doing right now, in hearing experts from around the state talk about what they are doing and what they're trying to do and have done successfully with regard to homeless services, whether it's Tucson, Phoenix, Flagstaff, you name it. So anyway, thank you for letting me put that plug in. And let me just say that I've been participating in these conversations, listening as director of the Arizona Department of Housing. That's what we should be doing, is listening to you, our community members, about the needs and the concerns about how we do spend this federal money. So thank you for letting me butt in. And
Oh,
thank you for
absolutely.
letting
Tom,
me do that commercial.
that's okay. It's a good commercial. And why don't we send the information? Here we've got a link to the workshop. Before you log off, what day?
It is August 18th to the 18th and I think 20th.
Great. Okay. Well, we've got, ladies and gentlemen, Tom will have to log off, but we have put the link to the workshop in the chat room. So you can just download that. Or if you have other questions, I'm certain we can just contact Arizona Town Hall and we'll get you in contact with, give you the link again. Okay.
Thank you,
Thanks,
Pat.
Tom.
Thank you,
Take
Suzanne.
care.
Bye, everybody.
Thanks, Tom.
So as I said, this question asks us to consider what broad categories should be prioritized to reduce disparities in health and well-being. Joe made the point about, well, this is one-time funding So we need to use that one-time funding for the very expensive projects that cannot be funded over and over again by local communities. Other thoughts, ladies and gentlemen, on categories? Terry, thanks.
Hi, and so Joe made such a great point. And I think that these funds are best spent to leverage future funds and future opportunities. So he hit the nail on the head by saying, get those shovel-ready projects or sites ready so that when there is opportunities for economic development and growth, that you do have all of that infrastructure in place. Very important. I think in the US also, and especially in Arizona and northern Arizona that I represent, the water and sewer, I think that we need to take the time to improve and our infrastructure in all of those capacities. And Pat, I know that you're aware that we're really focused on broadband up north as a sustainable utility going forward.
Terry, thank you. And of course, as we know, broadband is not just for business. It's the ability to communicate on health issues.
Yes.
Education, employment. It is a game changer. So Terry, thanks for that comment.
Sure.
Harvey, thank you. You'll need to unmute.
Thank you. One area that is usually left out of this kind of discussion is the field of emergency food providing. And so what we've discovered over the year of COVID is that the amount of food coming into Arizona had to increase dramatically. And then it would be moved out of the metropolitan areas into the rural counties and cities. The problem that arose and has not yet been addressed is that we have about 1,300 emergency food providers throughout Arizona, and many of them are in rural counties. They're usually organized under a church. They have limited facilities, but they have more people to feed. In some cases, they doubled or tripled the number of people that needed to come to the food bank. So when you're a member of a church, you're doing your work as best you can, but you need additional space to store food. That is a capital expense that they're simply not able to handle. And there is an overarching organization throughout Arizona called the Arizona Food Bank Network that is set up to be able to handle perhaps a grant program, if the money, or in some way where the money could be distributed to these rural food banks that need to buy a storage shed or do something on that order, but they'll never be able to do it with their own budget. So that's a capital need that generally is not recognized.
Harvey, thank you for that comment. That you're right. I don't think that comes up very often. Sherry, Josh, I know you're on the phone. I don't want to keep you from participating. So if you have a comment, feel free to weigh in here. Other comments, ladies and gentlemen? Yes, Kathy, and then I think I saw another hand, but Kathy, Hockey, and then Josh.
I know in the Flagstaff area here that the whole issue of housing, particularly affordable housing, is at the top of the list. And I guess I would wrap that up with, in terms of one-time expenditures with housing for the homeless. What we found during COVID is you couldn't use congregate shelters because of COVID. And that created a significant issue here, and I suspect in most of the other communities. They just didn't have the capacity to place people who tested positive for COVID. The other thing that goes along with the affordable housing piece is that people missed rent and mortgage payments and ended up out of their housing for the first time in their lives during COVID. And we're about to head up against that eviction moratorium end. So we're not just talking about single individuals needing to be sheltered. We're talking about families. So I think you could use the money one time, as was done on a temporary basis during COVID, to purchase some of these older motels that can be converted into space where people can be housed who either can't be in congregate housing for some other reason, or to house families. So you don't have a family of a single mom and 4 kids housed in one room in a hotel.
Kathy, thank you. There were some thumbs up on that in agreement. Josh?
I really don't have much else to add. Infrastructure and housing are huge for Northern Arizona. I agree fully, 100%.
Josh, thank you. Then I think I see a thumbs up with Harvey on that point as well, with the point Kathy made about housing and with using it for the infrastructure of housing. Other comments, ladies and gentlemen, on broad priorities with the categories. What should be first?
This is Caroline with US Vets, and I agree in terms of meeting critical needs. First, that should be a focus in terms of the stopgap measures. While it is a one-time lump sum and ongoing operations still will need to be covered, there often is money for operations. There's not frequently money for large-scale purchases such as properties to expand housing, accessible housing for everybody. And so, you know, I understand that the ongoing operations do need to be maintained in new housing facilities, but we need them to at least get built first, or acquired first, and renovated first, and then operations can, you know, sustain itself after that. And typically, there is funding available through the continuum of care and Arizona Department of Housing for services. And so, but it's the structure and the space and the property and acquisition itself where there just isn't often opportunities for those funding sources. And so meeting critical needs of, you know, I know in our area we have over 200 homeless youth in our community. That's significant in our small Pike County population. And so I think critical needs has to be a priority.
Carol, thank you very much. I have Nancy, and I think I saw a hand on the other side of my screen, but I'm going to call on Nancy first. Thank you.
Thank you. I would just like to go back to the broadband issue and point out that that is a serious cause of some of the healthcare disparities. And I know that you all know that COVID has made that very clear, but I know I'm in Flagstaff also. There are areas in Northern Arizona where there simply is no broadband, no internet, and not even really any cell coverage. And so these folks do not have the same access to healthcare. And if COVID is going to continue, like it seems like it is, you know, that telemedicine, telehealth is probably going to stay very important.
Nancy, thank you. Thank you. And let's hope COVID doesn't continue on. But yeah, but anything else? Don't forget to take a look at Kathleen's comment in the chat room. She very much would add to Harvey's point about the importance of cold storage for food banks. It's really a critical need.
William, you had your hand raised.
Yeah, hi.
Well, thank you. I'm sorry, I didn't see it. Thank you.
So one of the obvious things in healthcare and providing healthcare is providing doctors. I'm a family doctor in Northern Arizona, and one of the difficulty is to train doctors in rural Arizona, and if you train them there, they're much more likely to stay. One of our big problems in training programs for doctors is overcoming the initial cost of setting up training programs, residency programs for primary care doctors. It takes a huge amount of inertia to overcome that initial that initial cost. And once you get it rolling, there are other funding sources that kind of take over and move into those things. Certainly, if you're looking at expanding healthcare into rural Arizona, allowing places in rural Arizona to grow their own, to have their own doctors that grow up in the community and then tend to stay in the community and be part of the community. Lastly, one of the big problems right now that's obvious is a lot of people are hesitant to get vaccines and help stop this. One of the, probably the primary source is to go to your trusted family doctor like me, be able to sit down and talk about these things, and then have that one-on-one conversation of what's best for the patient. So allowing that seed money to get those training programs started, allow us to have local family doctors that then are able to take care of the community is something that shouldn't be overlooked. Certainly the hard infrastructure projects are absolutely necessary, and one of those infrastructure projects would be to grow our own, to have doctors in our own community. Thanks.
Well, and thanks for that comment. And indeed, in a related point in the chat room, in addition to having the people, the doctors, the medical care providers, having accessibility, and Danielle has suggested funding mobile units that provide health care in rural areas to reach people who don't have transportation and where we don't have bus service. Harvey?
Yes, mine is a little different. I've been told that Yavapai County, in which I live, is the only county without a housing commission. And because it has never gotten one organized, they're looking to grant funds at some point to be able to establish a housing commission. And because it doesn't have one, it loses out on a lot of funding. And so that's a simple, could be a one-time only funding project.
Harvey, thank you. Before we move on to question 2, then any additional comments regarding the prioritization of these broad categories that the American Rescue Plan funds will fund? Well, thank you. Let's then go on to question 2. It is as follows. Consider the specific areas noted in the American Rescue Plan Acts, again, such as education, human services, housing, direct aid to essential workers and the like, including behavioral health issues, health projects as well. What should the priorities be for utilizing this one-time funding in these areas or for these areas? Again, we're now in a particular category. What do you think should be the priority in that category for this one-time funding? And if you have the fact sheet that Vitalis prepared, it does explain the categories and how many billions go to each. And we're talking about a lot of money, ladies and gentlemen, including housing assistance, education, human services programs, behavioral health within human services, health-related programs, direct business aid, and then COVID response, which includes public health measures such as water, sewer, and broadband.
Pat, this is Terry. Let's talk about essential workers, because the worker shortage in Arizona and across the U.S. is critical and getting to be more and more critical as time goes on. It's critical for business. It's critical for health and education. And so I would prioritize, we can't mobilize any projects or opportunities unless we have good, well-trained folks in the labor force. So I'm going to say workforce.
Terry, thank you. And indeed, the plan authorizes premium pay of an additional $13 an hour to designated and qualifying essential workers up to a cap of $25,000. So that could be very significant in both recruiting and maintaining a workforce, and then of course fall in love with the northern part of the state and they'll stay here.
Of course.
Hi, this is Carrie Kelly. Tag on to what Terry said, I think we can't talk about workforce unless we also talk about childcare as well. We've seen so many exits in the past year because of COVID, and I think childcare is critical to getting people back to work.
Absolutely, Carrie. And Carrie, we have put into the chat room a link to the fact sheet that I've been referring to, so you can access it that way. Other comments, ladies and gentlemen? Yes, Raya? Please, and you just need to unmute yourself.
One suggested donation actually received a good deal of funds for their housing program. And
Raya, I think we're having, at least I'm having a hard time hearing you. Can the rest of you hear Raya? Could you put your comment in the chat room?
Advertising at first, but now people are.
We've had a hard time hearing you. If you could put your comment in the chat room.
Model for some.
I think that is a broadband problem. And again, this is the whole point we've been discussing. Right, if you could put your comment in the chat room, or perhaps you might want to disable your video, that might allow your broadband to get the audio. I'll return to you in a moment, see if we have everything is fixed. Other comments, ladies and gentlemen, on prioritizing the one-time funding in the various categories. Kathy, Hockey?
I guess under housing assistance, I'll just kind of restate what I said before. I think assistance for the homeless and supportive services and finding housing for people who can't fit into the normal housing categories just simply because they can't afford them or they're not available. So I think using money on a one-time basis for that it is a priority. I also want to follow up on what the doctor said. I can speak from my prior employment life when we had employees in remote areas. There is just an absolute lack of quality healthcare providers. And we have to do something to incent people to serve in those areas. Plus, I don't know if I can speak here, but in our circumstance, we found the rate of return for a doctor's practice in Phoenix was much better than it was for a doctor's practice in a rural community. So the idea of providing some payments and economic support to those practices who stay there and serve. I know here in Flagstaff, we have the Poor Medical Clinic, which serves people who have no other insurance of any kind. So we need to find ways to support the rural healthcare providers.
Kathy, thank you. Then Raya's comment is in the chat room, and she points out the Navajo Nation has been awarded funds for housing. And it may be a good model, keeping in mind the one-time type of fees we have been discussing, or funds. The nation has an application for members to complete that will assist them with security deposits, bringing outstanding utility bills to zero. Boy, that's fabulous. Or providing short-term rental assistance for those who have been affected by COVID-19. So the Navajo Nation really is taking leadership in a number of initiatives to address housing and related problems. Thanks for that comment. Yes, Terry.
I realize that public health has received funds, and we have been working on grants, these grants that can only be used for, COVID response. I know we're working on a workforce development grant that we're receiving from, I think it's from ADHS, or maybe ADHS got the money and we are being allocated a certain amount of funds for that, which is amazing. And I'm hopeful that that is going to help public health as it's been, a group of warriors in the public health that have been handling this pandemic. The ones of us that didn't stay home, that ones have been in the trenches since the beginning. And, they talk about, possible bonuses for those of us who have, and then I'll probably retire before that happens. So that won't help me at all. But I'm just saying that, public health needed the money, because it's definitely thrown a lot of people into the spotlight that are, have a lot of support from the state and from national health organizations and things. But, when you're out there, single-handedly trying to be the face of COVID in your community, it's a tough job. And how many public health officials, as is Dr. Kara Chris just, put in her resignation, but throughout the pandemic, of all these leaders in public health that have left because of the politicization of public health. Anyway, that's my soapbox.
Terry, thanks. I saw a couple people nodding in agreement on that point. There are additional categories that we haven't addressed. We've talked about housing, of course, but for example, business aid, $1.2 billion will be allocated to direct business aid. And that's monetary assistance to small businesses, including restaurants and the like. Do you have any thoughts about the allocation of that money in priority related services or projects? And then of course, don't forget education, programs and services. That includes after school programs, grants to college students, funding for schools and libraries, especially for internet. So what would you prioritize in these other categories that we have not yet discussed?
This is Josh with
Thanks,
Standing.
Josh.
Can you hear me?
Yes.
Yeah. So my hope would just be that it can be established places of business that have been providing services for years or decades. There are a lot of very effective and efficient operations in our region. There's just so many, when this amount of money is involved, there's the opportunity for these startups to jump in. And I just hope that we can make sure that money is provided to places that have a proven track record that they can assist those most in need in our areas.
Thank you, Josh. William, doctor?
Yeah, it kind of, I guess, goes back to the first part. I think a lot of smaller businesses have had difficulty getting people to come back to work or come to work. And a lot of it has to do with the childcare. And I think when you go back to trying to get people to come out of the woodwork, go back to work and support the businesses. Most of the business owners I've spoken with say that that's one of the biggest problems, is getting people to come back to work. And a lot of them are stuck because of the educational problems. They have to stay at home and take care of the kids and do home education. Hopefully we'll be able to get kids back in school. But I think looking at childcare for kids before they get into school and that childcare after school, that kind of program needs to happen to be able to get people to go back to work. And for businesses, I think a big part of the problem now is they just don't have the workers to support them. So I think that kind of goes back to doing something about childcare.
Thank you very much for that point. And indeed, one of the line items or the suggested funding projects under the education category is after-school programs, especially for our disadvantaged or homeless children who are kids in need. There are a couple of excellent comments in the chat room about, for example, Raya points out therapists and shelter and other nonprofits are notoriously underpaid. They should be prioritized in order to assist with retention of employees in this high need area. And then Danielle makes the point about there's a disconnect between people who have very low income and those who make too much to qualify for assistance. I mean, they're kind of in this gap area that they don't really have enough to do well, but they get maxed out because they have a little bit too much money. And so they have the same stresses, late fees, unable to qualify for assistance and the like. And she raises the rhetorical question, how can something like this be addressed? Well, that's why we're having this conversation. It's to talk about where should the American Rescue Plan Act funds go. Any other comments, ladies and gentlemen? We have a few more minutes left. Terry Drew.
I'll make a comment. Terry mentioned it earlier from Yavapai County, and I believe it's true with business funds as well. And that's that it's become very political. It's very political if you accept or receive funds and under which administration you receive funds. And there has been quite an investment in business. I'm not saying that there isn't still a need, but with the PPP and the EIDL programs, to my understanding, significant dollars have gone unspent. And then there's been some issue with fraud with those funds as well. So, my overarching comment, I guess, is to make sure that the distribution is fair, it's easy, and it's quantifiable. So folks need to, there needs to be some documentation that follows it and a clear understanding of what the intent and use of the funds are.
Good point, Terry. And indeed, if you look at the regulations that were issued by the Department of Treasury, you'll see there's accountability is kind of built into some of the regulatory requirements as well.
Mm-hmm.
Well, I think we're coming close to the end of our time together. Suzanne, I'd like to turn this over to you then.
I just want to thank you very much. We'll send this out to the others that had RSVP'd and provide them opportunities to comment as well. There will be a number of other programs. So if you know somebody who wanted to make comments and wasn't able to attend, you can just go to the Arizona AZTownhall.org to get information on the future other town halls, the community town halls that will be occurring. And then let me turn it over to Tara to talk about we've got some other town halls talking about, again, creating vibrant communities.
Thanks, Suzanne. And special thanks also to Pat and the one person who you may not realize is doing a lot of work behind the scenes, Mary Greer, who is taking your comments and typing up all of these into a report that will not only be used by some of the folks who will be watching the recording or sitting in and listening, but also Suzanne will be distributing your thoughts and comments from those reports that Mary's putting together. So thanks, Mary and Pat and Suzanne. And this is, these conversations are very interrelated with the work that we've been doing in partnership with Vitalis for almost 2 years now. And there are some wonderful resources, not only on our website, but that we can provide to you a background report on creating vibrant communities and what are the elements that allow that to happen. We have been having community town halls on the topic throughout the state. So far, they have all been virtual, although we have some of our first in-person ones scheduled. Hopefully those will continue to go forward as in-person or as virtual, including, I believe, on October 8th. We just scheduled this, but we have one in the Verde Valley, working with a group of folks from the Verde Valley. We don't have registration for that yet, but I certainly hope you'll continue to check back with us and be a part of these discussions. We really appreciate your input. This is a great group of leaders in this conversation, and we really also appreciate all the work that you're doing in your individual capacity. So thank you for that.
Well, thank you all very much for being here today. One last comment in the chat room, which is from Kathy Hockey with the agreement by many, which is under the category of direct COVID response, spend money in Northern Arizona to increase vaccinations. And so a lot of agreement on that point. So with that said, ladies and gentlemen, go off, stay safe, have a good weekend. And I hope, and we all hope to see you at some of our town hall Vitalis discussions on creating vibrant communities. So take care all.
Thank you.
Bye.
Have a good day.